To warm up before you start interpreting for this simulated session, that is going to include a patient and a provider, let's try a vocabulary exercise. On your screen, you see the cheat sheet or a list of vocabulary that will show up in this simulated session. As a warm-up, I will be listing either terms or phrases that will come up in the simulated session. As I go through them one by one, interpret or say the term or phrase in your language of service. Write down any that you don't know. Do this without looking at your screen because the screen will have the answers for you. When you are done, go back and take a look at the ones you were not sure about or ones that you did not know how to say in your language of service. Study them, learn them, and then start with the simulated session. EMR. A hint for number 1 is EMR is electronic medical record. Cardiologist. A hint for cardiologist is the doctor that specializes in the heart. Tightness in the chest or chest tightness. Sharp pain. And dull pain. Exertion. A hint for exertion is, another way of saying it is while you are active. Jaw. Intense. Palpitations. A hint for this one is make sure that you do not confuse palpitations with heartbeat. Remember that palpitations are not a regular heartbeat. It can be a sensation that the heart is racing, pounding, fluttering, or skipping a beat. My heart is racing. My heart is pounding. The pain happens independent from the palpitations. Different way of saying this is the pain happens with or without the palpitations. Dizziness, lightheaded, lightheadedness, weak. Have you ever fainted? Do you ever feel like you are going to faint? The name of a medication, meloxicam. Meloxicam. Topical cream. Remember, topical cream means cream that goes over the skin. The name of another medication, Voltaren. Is another medication, loratadine. Another medication, levothyroxine, sometimes pronounced levothyroxine. Thyroid. Take the medication on an empty stomach. EKG. And remember, this means electrocardiogram. Be sure to fast before you come in for your blood tests. Come to the lab for your blood test. This test will record the activity of your heart. Electrical activity of the heart. An EKG gives us a record of the activity of your heart. Heart rhythm. Poor blood flow. Another way to say poor blood flow is inadequate blood flow. Ischemia. And remember, ischemia refers to an inadequate blood supply to an organ. So ischemia is a condition of an organ not receiving enough blood supply. Blocked artery, narrowed artery, structural problems or problems with the structure, heart chambers or the chambers of your heart, catheter, heart catheterization, non-invasive. Electrodes. You do not need an appointment. Patients are seen on a first-come, first-served basis. You do not need an appointment. Patients are seen on a first-come, first-served basis. First-served basis. Caffeine. Ounces. Be mindful of your activity. Another way to say be mindful is pay attention. Short of breath. Crushing chest pain. Emergency room. Pulse. Implantable device. Regimen. Another way to say regimen is a prescribed course of medical treatment or prescribed medical treatment. Diuretic, anticoagulant, diuretic, vasodilator. Paper gown, leads, also sometimes they are called cables, tablet. Take a moment to review any terms that you need to review, any terms that you got incorrectly or you needed to look up. Before you start the interpreting practice, be sure that you have something to take notes with. Be sure that your recording tool is working. Be sure that you are able to pause or rewind the video if you need to get a repetition or more time for interpretation. And be ready to submit your recording for credit. The simulated session will start now.
How are you this morning, Elena? I'm Dr. Maddox. Please take a seat.
我很好，谢谢。
I'm pulling up your chart here on EMR. What doctor referred you to me?
Small 医生把我从那个64街的诊所转到来这边，他是我们的家庭医生，我的孩子和我的丈夫都是去那个诊所的。
Do you know why he asked you to make an appointment with a cardiologist?
我去找他看病的原因是因为觉得胸口痛，有些时候我在躺下来的时候，感觉好像有人坐在我的胸口上。
How long ago did the pain and tightness in your chest start?
我想大概2、3个星期前吧，我不太确定。我忙着照顾着我的孙子孙女们，有些时候甚至都不知道今天是几号了。
Can you describe what the pain feels like? Is it sharp or dull?
疼痛来得很突然的，就好像被什么东西刺了一下的似的。
Does anything make the pain worse, like exertion?
我知道我自己在变老，不过我得照顾我的孙子孙女们呐、总共有4个呢。他们的精力非常旺盛，正在忙着照顾他们的时候啊，有些时候我感觉喘不过气来了，就好像有人在挤压着我的胸。可是我觉得可能是因为我变老吧，是不是？我告诉他们要乖，不过他们还只是孩子嘛。
Four grandchildren, that is a handful. Sounds like you're an amazing grandma. Do you feel pain anywhere else?
我的后背和肩膀的周围有点酸痛，我已经无法抱孩子了。如果抱孩子的话，我的胸就会更痛。
Do you have palpitations? Like a feeling that your heart is pounding or racing?
是的，有时候感觉心脏就好像要准备从那个胸口跳出来一样，我可以感觉到耳朵和嗓子里的那个心跳声。
Would you say this happens every time you exert yourself or sometimes when you exert yourself?
可能不总是这样，不过大多数的时候，当我想快点忙完、走得快啊，或是提东西的时候呢，就会发生这种情况的。
How long do the palpitations last? Would you say they last less than 30 seconds, more than 30 seconds, or more than a minute?
嗯，这种情况呢不会持续很久，可能就不到1分钟吧。但是那个感觉是很强烈、很吓人的。有些时候我必须停下手头上的工作，先休息一下。
And does that help?
是的，如果我坐下来冷静一下的话呢，那个疼痛感就会减轻。不过我一定要坐着，如果我躺着的话呢，胸部就会觉得更有那种紧绷感。
Are the palpitations usually accompanied by the pain, or do they ever happen independent from the pain?
一般说呢，感觉的话，两种情况都会有。
Do you feel any other symptoms like dizziness or feel lightheaded?
有一两次我不得不坐下来，因为我觉得头晕、体虚，我怕自己会摔倒。
Have you ever fainted?
没有。
Okay. Elena, did you bring your medications with you or a list of the medications you're taking?
有，我带了过来。
Perfect. Thank you for bringing them. Let's see. What do you take meloxicam for?
医生开给我这个药呢，是因为我的膝盖和背部都有关节炎。医生告诉我，我需要的时候呢，一天可以服用2次。我还有一种药物呢，是那种治疗疼痛的药膏，叫 Voteran，但是我没有带，因为我用完了。
Okay, and loratadine is for allergies. And levothyroxine?
是的，这个是用于甲状腺的，我每天早上都会空腹吃一片。
Do you smoke, Elena?
没有，从来不抽烟。
Good. I'm going to order a few lab tests to take a look at your cholesterol levels, check for anemia, and evaluate your thyroid function. I'm also going to order an EKG. You will need to come back to do the test because these tests require that you fast beforehand. You can take your thyroid medication, but don't take or eat anything else before you come in. The lab opens at 7:30 in the morning. I recommend that you not eat anything after midnight the night before and come as early as possible the next morning.
好的。
Have you ever had an EKG?
我不确定什么是 EKG 心电图。
An EKG is a test that records the electrical activity of your heart. That record helps us assess your heart rhythm. We may also be able to see if there is poor blood flow to your heart muscle. That's called ischemia. The EKG also helps us detect blocked or narrowed arteries and any structural problems with the chambers of the heart.
是不是就像在那个脚上要插导管的一样？
No, that's called heart catheterization. An EKG is non-invasive, and it's done using electrodes that are placed over the skin on your arms, legs, and chest.
那做这个测试之前，我需不需要准备什么？我必须在化验的同一天做这个吗？
It's up to you if you'd like to do it the same day. You don't have to do anything to prepare for the EKG. Just remember, there are no appointments for the lab or the department where the EKG is done. Patients are called on a first come, first served basis. Mornings are usually the best time to come in. I'd like you to come in for the test no later than next week, so I can see you in 2 weeks and discuss the results with you. I'd also like you to limit the amount of caffeine you drink in a day to 1 cup per day. Do you drink coffee?
是的，我早上一定要喝咖啡。
Okay, so just 1 cup a day, no more than 6 to 8 ounces.
只要你不说我不能喝咖啡。
I wouldn't do that. 6 to 8 ounces is okay. I'd also like you to try to minimize your activity. I know you said you watch your grandchildren, but I'd like you to be mindful of your activity and try to take it as easy as possible.
好的，我准备跟小孩他们再谈谈吧。
Great. Tell them to take it easy on Grandma. In the meantime, if you get extremely short of breath or experience crushing chest pain that lasts more than 5 minutes, I want you to come into the emergency room if someone can drive you, or call 911 if you're alone.
好的。
Okay, so we'll see you in 2 weeks.
谢谢医生。
Can you verify your first and last name and your date of birth, please?
Elena Angelo，生日是1962年4月8号。
Thank you. You can put your purse and coat down here. Have you ever had an EKG before?
没有，从来没做过。
Okay, the entire test will take about 5 minutes. I'm going to ask you to undress from the waist up and change into this gown. Leave the opening in the front. I'll give you some privacy to do that. When I come back, I'm going to place some stickers on your arms, chest, and legs. Let me see your shoes. I'm going to ask that you take your shoes and socks off as well. I'll attach one of these electrodes to each sticker. The electrodes don't have needles, so no poke, no pain with this test.
哎，挺好的，因为我不喜欢针头。
Yeah, so you shouldn't feel anything. I'm going to ask you to sit still once we start the test, and at some point, I may ask you to hold your breath for 5 seconds. The test is going to measure the electrical activity in each part of your heart, how fast your heart is beating, and it will also tell us if you have a regular or irregular pulse. Do you know why they ordered an EKG? Is it part of your routine physical exam, or were you having symptoms?
我的医生让我看那个心脏病的专家，因为我一直感觉到胸痛和那个心烦的感觉。
Are you feeling chest pain, palpitations, or shortness of breath right now?
没有，
Do you have a pacemaker or any other implantable device to support your heart or circulation?
没有，
Do you take any heart medication or medication to lower your cholesterol?
没有，
Does your doctor have you on an aspirin regimen?
没有，
Do you take a diuretic, sometimes called a water pill?
没有，
How about an anticoagulant or vasodilator?
没有，
Did you take any medication today?
是的，我吃了甲状腺的药，医生告诉我可以吃。
Do you know the name of the medication?
是的，这个药叫做甲状腺素，但医生告诉我可以服用，而且不会影响检查的。
Oh, yeah, it's fine. These are questions I have to ask everyone. Okay, I'm going to step out and ask you to put on this lovely paper gown. Leave the opening to the front. Only undress from the waist up, and take your shoes and socks off too.
双脚也需要脱下吗？
Does it have an underwire?
是的。
In that case, I'll need you to remove it as well. When you're done changing, please sit here on the table. Knock knock, can we come in? Are you dressed?
是的，请进。
Okay, I'm going to have you lie back and get as comfortable as possible. Let me know if you need me to raise the head of the bed.
哦，不用了。
Okay, I'm going to ask you to untie the front of the gown there so I can place the stickers on your chest. You don't have to open it all the way. I'll keep you as covered as possible.
好，谢谢。
I'm going to roll up your pant legs so I can place one near each ankle. Actually, I'm going to roll them up a bit higher and put the electrode a bit higher up on your leg. Good. I'm going to connect a lead to each electrode pad. Okay, how are you feeling? Are you warm enough?
是的，我很好。
Good. I need you to lie very still. Don't move or talk. This will be very quick.
好的。
And that's it. I'm going to remove the electrodes now.
做完了，挺快的。测试结果怎么样？你能告诉我有什么问题吗？
The information from the test will be sent to the doctor who ordered the test, and they will discuss the results with you.
不过你就能不能告诉我是否一切顺利，或是我需不需要注意一些东西吗
I'm in charge of performing the test. Then your test needs to be read by a diagnostic radiologist, who then sends the results to your doctor, and your doctor will discuss the results with you.
我懂，但是你都做了这个测验嘛，你有没有什么可以告诉我
Mrs. Angelo, the information is simply not ready yet. Do you have a follow-up appointment already scheduled with your doctor?
？55，是的，在下周。
Good. Your doctor should have the results within 48 to 72 hours, which means he or she will have it by the date of your appointment so they can discuss it with you. If your appointment is for more than 3 days from now, you may be able to call your doctor and see if they can discuss the results with you over the phone before your appointment.
$56啊，好吧，谢了。